For more than 150 years, the American Public Health Association has been championing the health of all people in all communities. As thousands come together in Atlanta, Georgia for the 2023 annual meeting and exhibition, APHA TV is showcasing the best practices for improving overall public health. Welcome back to Day 3 of APHA TV. I'm Deidre Johnson. The American Public Health Association's mission to improve the health of the public means overcoming social and ethical challenges. Today, we are focused on the specific ways they are doing this.
Each in their field, they've developed some specific form of expertise. How do you build leadership? How you negotiate resources.
Tackling public health from the bottom up. From the general public to policymakers, hear how the APHA is making sure everyone has a seat at the table.
There is definitely a sync between transportation and public health. You can't really have one without the other.
Plus, our must-see sit down with a key transportation official, how they are making sure healthy transportation is accessible to all.
This is the time to really forge partnerships and alliances to promote disability inclusion.
And today we visit the institutions focused on health equity for everyone. Remember, you can always go back and watch any portion of today's episode, playing on the TVs throughout the convention center, on the in-house channels at several of our partner hotels, on the APHA website, where you can click through the video playlist to find even more exclusive meeting content, and on our YouTube and X pages, formerly known as Twitter. First up today, we take a trip to Michigan University's Center for Excellence in Developmental Disabilities. Their vision that all people, including those with disabilities, are able to fully participate in their communities is quickly becoming a reality.
The Michigan Developmental Disabilities Institute is the federally designated University Center of Excellence on Developmental Disabilities, or USED, for the state of Michigan. USEDs serve as the bridge between academia and the community, and we do that through training, community supports and services, research, and information dissemination. And our vision is healthy communities for all. And the way that we're going about this is we've created criteria to become a most valuable provider. This means that a site is accessible, sensory-friendly, and welcoming to all people, including those with disabilities. Currently, we have 14 MVP certified sites across our state. We started with the Wayne Health Mobile Unit, and they've been our partner since the beginning. And we want to expand MVP certification across the state, getting all 45 local health departments as well as many healthcare systems as we can.
Staying on the same campus, Michigan University's School of Public Health is joining forces with other notable associations to improve health equity for historically marginalized communities.
The Collaboration for Equitable Health is a $25 million funded initiative by the Bank of America to bring together the American Heart Association, the American Cancer Society, the American Diabetes Association, and the University of Michigan School of Public Health to tackle chronic disease issues facing the nation across 11 cities, specifically in historically marginalized communities.
This is a wonderful example of a partnership that crosses boundaries across sectors, allowing an academic institution to collaborate and partner with amazing health nonprofits, and then also in the private sector with support from Bank of America. So I'm really, really delighted. And I hope actually that this collaboration will serve as a model that spurs similar kind of activity addressing other public health needs.
Correcting problematic transportation systems is key to improving overall public health, and the U.S. Department of Transportation is taking steps to do just that. Veronica Macbeth from DOT is here now to explain. Welcome. Thank you so much for being here.
Thank you. Thank you for having me.
So talk to us, first off, why is the U.S. Department of Transportation here at APHA's annual meeting?
Well, we're here because there is definitely a sync between transportation and public health. You can't really have one without the other. The goal is with public health components within transportation is making things more accessible, sustainable, recognizing climate issues, and also making sure people who are in disparate populations have access to the health care they need to get to work and the places they play. So that's why it's really important that we're here.
And so a lot of people don't think of public health and transportation together, but what you just said, again, tell us again why it's so important really to talk about this now.
It's important to talk about it now, and it's always been important. I think with the Biden-Harris administration, they have really tried to prioritize the connectivity between climate, sustainability, public health, and then more traditionally taking a look at the equity components. And equity and environmental justice, as we know, are really critical parts within the public health community, and it kind of marries all these things together. So in taking a look at those things, as far as the public health components in correlation to transportation, it's an equity issue too, making sure that we're righting the wrongs of the past where we have historically built infrastructure in Black and brown neighborhoods that have increased pollutants, where subsequently it has caused people to have health implications. And now we're taking a look at how do we fix these issues. We have some amazing discretionary grant programs that help address these very issues, whether it's the planning components or the capital actual building components to help address equity issues that subsequently also connect to public health implications.
Okay, and talk to us about the bipartisan infrastructure law.
The bipartisan infrastructure law is the largest infrastructure law that has been put into place, around $550 billion explicitly dedicated to deal with infrastructure issues, railways, airports, actual ports for shipping issues, also transit, railways, commuter rail, every entity within transit, it's available to assist in. So the funding includes, which is formulary funding, which is money that's allocated to states each year based on formula programs. We have a Reconnecting Communities and Neighborhoods grant that recently just closed in September, but we will have another cycle in the spring. One of the critical parts that we made sure of in taking a look at these grants are making sure they address what we call Justice 40 initiatives. And Justice 40 is a really critical component of the Biden-Harris administration, talking about and taking a look at infrastructure fails, transit and fails, and then taking a look and how do you spin this into a positive category, right? So making sure that at least 40% of applications and funding is directly going to impacted and disparate communities. And subsequently, these are also the same communities that do have high public health impacts. Going back to the Reconnecting Communities program, this is about fixing infrastructure issues that have systemically divided or were just dealt with through systemic racism and issues like that. And so addressing those issues, perhaps tearing down a highway that went to nowhere, that separated a neighborhood that now people can get to fresh food and grocers, so you don't have the impacts of being in food deserts. These folks have access to get to medical appointments and all the things that you would want in a public health and equitable component that does overlap and correlate with transportation.
And you spoke about the grants and funds. They're really helping local communities too.
Absolutely. So lots of this funding is great for states, but also really helpful with local communities, MPOs, some even public health organizations can partner with state and local governments to even apply for some of the discretionary funding. We have a program called Safe Streets for All, and public health organizations can actually apply for funding for those. We have Vision Zero, where we're looking to make sure that there are 0 deaths, and that's a process that goes through PHMSA, which is one of our programs here, and we're actually here at the conference, so you can check out their table. But the goal is to make sure that there are 0 deaths from transportation or car incidents. So lots of funding opportunities, lots of desire to play well and interact with other agencies, specifically public health organizations, because we know how critical it is.
Well, thank you so much for being here and for talking to us about the importance of transportation and public health working together.
Thank you.
The concept of a bottom-up public health approach is making sure that everyone from grassroots organizations to political parties can weigh in on the process of policymaking. Let's hear how this approach works.
Too often, people think that public health is just a set of policy some policymaker, decide of, and then they are implemented in communities. But it doesn't work like that. And so bottom-up means integrating the voices of organizations that belong to the community to which, the public health policy is directed to. Any group that represents some either organized sector of the population, like unions, on the workplace, or community organization, grassroots organization, and in the case of the LGBTQ community, who were really the pioneers in this area, organizations that represent them. In the 80s, when there was the crisis and the AIDS epidemic, the reaction of the LGBTQ community was extremely strong. It was reactive, but it brought the essential concept of bottom-up public health is that nothing for us without us. And this is something that needs to be expanded to other groups, because each in their field, they've developed some specific form of expertise. How do you build leadership? How you negotiate resources. And bringing together all these experiences and expertise is likely to transform public health.
Now, let's see that type of true community engagement in action. The University of Missouri's Kansas City Health Equity Institute is expanding access to healthcare and prevention programs for underserved populations.
OHJC started during COVID. We realized healthcare inequities that were really facing the minority population in our city, and so we felt like we need to do something to give them access to health care, give them access to preventive screenings. And the biggest thing, I think, was we had to really convince the community to trust the vaccine. That was the number one reason. And we felt like going with some institutions that were local to our community, that really cared about our community, that we could invest in that and then have them go out and do this work for us. And that's why Dr. Jeanette Berkeley-Padden from UMKC came in, along with University Health, along with Children's Mercy.
We want to be able to continue to see those type of community level indicators shift, see our people getting healthy, keeping our people out of emergency rooms, because if we can do preventative care, if we can do preventative health screening and have prevention programs like diabetes prevention programs, then we can begin to make a difference.
Public health can be a challenging but extremely rewarding field to work in. But building and retaining the workforce is key to weathering current and future public health challenges. To discuss this issue, we're joined by Dr. Brian Castrucci. Thanks so much for being here.
Thanks for having me.
So talk to us about this incredible study, and everything that you just recently did.
Well, we were able to look at turnover in health departments between 2017 and 2021 using our Public Health Workforce Interest and Needs Survey. And really the top line is we've lost about 50% of the workforce between 17 and 21. And when you look at younger people, it was 75%. So when you have this kind of turnover, you're losing experience in that health department. And so when the next pandemic comes, folks won't have had that experience. And so we have these two kind of things working together. We have people who have been older and who've been delaying retirement. As they start to retire, if the young group starts to leave, that's a perfect storm. And it means really a dangerous time for our nation.
And so tell me, as far as this study and everything, you said 50%, right? So what did your study find was the reason?
Well, I think we're understanding it's burnout, it's salaries, it's a whole myriad of things, but it's fixable. right? We need to really invest in how we lead our public health workforce, in our managerial training. We need to have loan repayment. We need to make public health a job that is really enticing to people coming out of their MPH programs. And this is something that is controllable. I mean, if these data were for physicians, there already would have been congressional hearings and more money to HRSA.
And so talk to me also about the importance of data modernization and what that means.
Well, data modernization is so important because we really need to understand the landscape of the pandemic and our health. And right now, data are old and segmented and not at the right level of geographic aggregation. So I might need data at a county level, but I don't even have a state level. We can't continue to have data malpractice in public health. But we also really need to focus on data justice because data and how we collect data is rooted in the same systemic oppression and biases that all of our practices. Data are not clean, they're the original sin. And so what we have to do is really focus data justice on making sure that those who are reflected in the data have a voice in how it's collected. And that's the only way we're really gonna modernize our data. So there is no data modernization without data justice.
So talk to us about the de Beaumont Foundation.
Well, the de Beaumont Foundation is a private philanthropy that we've been working in public health for really since we started in 1998. And so we are dedicated to ensuring that every community has its chance to achieve its optimal health. And we do that by working in policy and working in the workforce and developing partnerships. So something that's really critical to us right now is partnerships between public health and the business community. This is a critical partnership that we need. And what we saw during the pandemic is that the relationship didn't exist. We need to have those relationships so that when we have to make hard decisions, we are flanked by our business leaders in the community and our faith leaders and all the other partners who can support these decisions. And not that they're easy decisions, but they can be more palatable if we understand why it's happening and that we really took everyone else into consideration as we made these decisions.
Well, amazing work, amazing study. Thank you again, Brian, so much for being here. We appreciate it.
Thank you.
Time to highlight the High Court. APHA TV is exploring the impact of the Supreme Court's decision on college admissions that will highly impact minorities for years to come.
The Supreme Court decision to end race-conscious admissions does not end race-conscious admissions. It certainly reverses the standard or the precedent we've had for at least 45 years as to how we can admit students with race consciousness in mind. But it does so in a severely narrowed way. The Supreme Court's decision is commonly misconstrued because there's a concerted effort to make sure that it is. In other words, there are people that would like us to think that affirmative action is dead in every single aspect. The misconstruction is that diversity can no longer be a value that a higher education institution serves. It still can be. We just need to be very, very careful about the way we pursue those goals.
It is important for us to remember that the Supreme Court's decision does not prevent us from recruiting students of a diverse and racial ethnic background. It is very important for us to go to schools, go to colleges, increase their understanding of public health and what it offers as a career, and as such, encourage them to apply to these programs. Once you have enough of diversity within your applicant pool, half the work is done, and that increases our likelihood of finding committed and competent students to join our graduate programs.
We have seen an uptick in our applications for medical school and for our Masters of Public Health. I was on a phone call the other day with the other HBCU presidents, and they too are seeing an uptick. And so what do we do with that information? It's about increasing the number of faculty and also making sure that we are modernizing the curriculum to actually be even more inclusive. So we are being prepared in the way to accept an increase in the number of students, but we want to be able to give them continued rich experience. What I would say to those leaders in higher ed, it's the same thing I would say to those students who are grappling with the decision at the SCOTUS: stay the course.
There are ways in which we can continue to make sure that the educational experience for all students includes the educational benefits of diversity, looking at race as well as other diversity factors based on each individual's experience, characteristics, and contributions to the institution.
Encourage academic institutions to hire faculty that are of a diverse backgrounds. Students are seeking programs where they can see faculty that represent them racially, ethnically, and culturally.
At Morehouse School of Medicine, we are so excited that we never have to use race as one of our criteria for selection of someone to come to medical school. We look at something called adversity scores, which align with our mission, our values, and our vision for achieving health equity. And we've been able to continue to seat a diverse class, and I think we're going to be able to do this into the future.
At Texas Southern University, the Center for Biomedical and Minority Health Research is your gateway to cutting-edge biomedical studies, offering vital support for diseases affecting minority populations.
The main purpose of our Center for Biomedical and Minority Health Research is to address the existing disparities and inequities in health care, especially among our underrepresented minority populations here in the United States, and more specifically for us in Harris County and Greater Houston area. We have several research areas here, and my lab mainly focuses on maternal health and child health research in terms of epidemiology work, looking again to close those gaps in health disparities here in our Greater Houston area and Harris County. The other type of research that I do is drug discovery and development research, where we look for new medicines for specific infectious diseases. We hope that in the future, with all our work, we hope to see that the synergy of working together with the key stakeholders will really move the needle when it comes to reducing breast cancer health disparities within our community that we serve.
As we continue to highlight APHA's Women's Leadership Institute, today we are shifting to the social determinants of health, equity, and partnership. Here now is Siobhan Arline Bradley and Takesha Dewan Everett. Thanks so much for joining us here today.
Thanks for having us.
So wonderful. Talk to me first off about, health inequities and everything, and about the importance.
Health inequities are really entrenched in what we've seen in our country. Challenges with racism, classism, gender discrimination, limited access to education, healthcare, those determinants that we keep talking about. The reality is, if you do not live in a safe space, if you do not have access to quality care, if you're not able to, in this country, be able to earn a living wage, then you may be in a population that will have challenges achieving equity. And so for the work that many of us do, I'm in civil rights, but I'm also a public health professional. Every day I realize that our fight is to change those systems to be able to create that optimal health experience.
Okay, and Takesha, did you have some thoughts about this?
Sure. I think sometimes when we talk about racism, people think about, whether people individually like each other on a basis of skin color. This is beyond that. We're talking about the structural discrimination that has happened in our country that results in areas of concentrated poverty, that results in underutilized resources in communities. This is about systems and structure. It's not about individual behavior. It's beyond that. We don't care, personally, I don't care if you like me because of my skin color or not. It really is about, do I have the best opportunity where I live, work, grow, and play to be the healthiest person I can be? That's what we're really talking about when we're saying health and equity.
And so what policies, are important to make sure that, we change that?
I think one of the places that I would land is, as a public health professional, looking at ways that appropriations fund public health work. And so as we're looking at long-term public health care and public health infrastructure, those kinds of policies are very important. I also want to say this, policies that are, something may surprise you, connected to opportunities for voting rights, access to equal pay. These are policies that I am following specifically as an NCNW president, because we know that if we have communities that have access to capital, access to housing, et cetera, looking at opportunities to be able to have access to vote, to identify those leaders that engage on public health practice, that is something that is a priority for us.
Yeah, Trust for America's Health, we really do care a lot about the public health infrastructure. Are we able to withstand the opportunities for public health that we can have to advance the public's health, and are we able to be resilient in the face of challenges such as the 2020 pandemic? And we know we're underfunded, under-resources in public health, but I also want to say it's not just public health strictly. When you think about public health, some people think about health departments, some people think about medicine. This is also about transportation, climate change. How are we addressing the challenges that we're seeing in our climate work? It's about obesity and how those rates are climbing, not because of individuals, but because of our structural disadvantages around access to health. So those are the things that we're saying when we're looking at policy. We know when you center equity in a policy decision, regardless of what it is, you're going to advance the public's health.
And so talking about the importance of having women of color, in leadership roles.
In general, the key thing is we have to have people who reflect those who have been disadvantaged in our society for a long time and opportunities for leadership and places to actually influence decisions.
Yes.
So when you talk about why it's important to have women of color specifically, we are and see what's going on, and we can bring that viewpoint of how our lived experience has been and what the lived experiences are of our communities, of our aunties, of our grandmothers. We can all bring that to the table. So when we are able to be in positions where we can make those decisions, where we can influence those decisions, we give you a viewpoint that you otherwise would not have and a connection to community that you just can't get without us.
When you're talking about women of color in leadership, you're also speaking to a population base that historically has not had an opportunity to be at certain tables. And that was by law, right? So what we're saying now is our country is changing. Our country's demographics are changing. And I want to, address the elephant in the room. It is not in spite of white populations. This is in addition to, right? This is what we talk about overall collective leadership that features women of color, that features black women, that features women who are mothers, right? Women who are living with a disability. Let's talk about all these experiences. And if we create more opportunities for black women, you will see policies change. You will see opportunities for infrastructure to change because we've been trained and we've been able to experience those things in our overall communities.
And now y'all are also working on a project together. Talk to me about that project.
Good Health Wins.
Yes. So you want to start?
Good Health Wins is really an opportunity to advance something called a community of practice. And the Good Health Wins work is it started really when COVID happened. And NCNW received a partnership grant with the Center for Disease Control. We have leaders like Trust for America's Health, Vaccinate Your Family, and a massive network of our affiliates. So the Divine Nine is a member. We have the National Black Nurses Association, and also some of our states and local sections that are interested in integrating public health into your work. And I'm quite frankly excited about it because I believe this is a pilot for more opportunities to do more work.
Yes, Good Health Wins is an example of when you have people of color at the table, the conversation shifts. When we go back to the pandemic and looking at how the vaccination rates, first off, vaccine was not getting to populations and the rates in people of color were not high. But when you have an opportunity like involving Good Health Wins, you see when you come to the table with a campaign that's for the people, by the people, the vaccination rates increased. People began to trust the vaccine.
Absolutely.
So we're really excited about this partnership because it is, like you said, a pilot of what's to come. When you involve the community in the conversation and trusted partners, we can change the world.
All right, I want to thank you all so much for talking to us today about these important policies and everything. So thank you again so much.
Thank you.
Keeping our focus on social determinants, research has shown that Black Americans experience twice the risk of developing Alzheimer's and related dementia as other races. Check out how one center at the Washington University is working to disrupt the social and economic conditions that drive ADRD inequities.
We often hear that African Americans or those across the African diaspora are twice as likely to be diagnosed with Alzheimer's disease and related dementia. So it is important that we have a culturally appropriate research registry.
So ARCHES stands for Aging Research Characterizing Health Equity via Social Determinants. We wanted something to be emblematic of St. Louis, Missouri. So it is a prospective, observational, 5-year study that was funded by the National Institute on Aging And we are essentially following 300 middle to older African Americans.
I think that there is a myth that communities of color aren't interested in participating in research, when we are if asked. And that's what co-equal is. It really reflects the vision of being equitable and having equality in a way that all voices are heard.
Our final stop today is at Montana University. The Center for American Indian and Rural Health Equity is putting Native Americans at the forefront of community-based research.
The Center for American Indian and Rural Health Equity, we call it CARE. It is a center that is funded by the National Institutes of Health, and it's designed to really create long-lasting, trusted partnerships with rural and Native American communities across the state and beyond in order to improve health equity for those communities.
There are 8 reservations in Montana, 12 tribes. We have a lot of differences, but there's also many similarities. One of those similarities is health disparities.
In order to support CARE, we need partners. We would love to have more donors and foundation funding, because that would really help with some of the dissemination work. I think the other thing is for investigators to find us and be able to offer them particular training.
We're really excited to continue our important research partnerships with rural and tribal communities and really disseminating our interventions to other communities more broadly in the future.
Thanks for your time here on this third day. We still have one more full day here at APHA. But if you missed any portion of today's episode, you can always find the latest APHA TV episode playing on the TVs throughout the convention center, on the in-house channels at several of our partner hotels, on the APHA website where you can click through the video playlist to find even more exclusive meeting content, and on our YouTube and X pages formerly known as Twitter. We will see you right back here tomorrow for our final episode of APHA TV.